My name is Amir Kazory. I am from University of Florida. This is the 21st World Congress on Heart Disease in Boston. I just had a talk on the role of peritoneal dialysis in the management of patients with heart failure. I gave an overview of the data that has been existing for a few years now. What we know is that peritoneal dialysis is a potential option, and I went through the biological plausibility of this method of treatment. Then I talked about the clinical plausibility, coming up with some proposed benefits that is in the literature on the role of peritoneal dialysis in heart failure, and I ended by talking about the clinical studies that have been done in this field. I talked mostly about one of the studies which is done in France by Dr. Crivo and her colleagues, which so far is the largest study in this field, and showed that when we start a patient on peritoneal dialysis, a patient with heart failure that is started on peritoneal dialysis, we have a great beneficial impact on the days the patients come to the hospital for heart failure related complications. In other words, when you start a patient on peritoneal dialysis, they come much less often to the hospital for these complications, and as such it is possible that the cost of the care for heart failure patients could be reduced significantly. This is one, and obviously the morbidity comes down, as well as improving the quality of life for the patients. So all these together make peritoneal dialysis a viable option for patients with chronic heart failure. We would know in the future if these beneficial impacts would also translate into a benefit on survival, and also obviously the cost of the care for these patients. As you know, heart failure is one of the most expensive diseases for the human, and has the highest rate of readmission, as well as it is the most common reason for hospitalization. So all these together make peritoneal dialysis an option that at least should be explored.